Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. So I think we can start lah. We can start our weekend booster with Kita Al-Fatihah. So for our topic today, for our topic for our this weekend booster is about fever, and it will be given by our speaker, Dr. Hasnain. So without further ado, I think I will call upon Dr. Hasnain to deliver his talk. So please welcome, Doctor.
Hello, Assalamualaikum. Very sorry, I have some technical issues just now. You guys can see my screen, right? All right. Thank you very much. Hi, everyone. Good morning and Assalamualaikum. Thank you very much for inviting me for this topic. Actually, I wouldn't say I'm any kind of an expert on this, but I will just share whatever that I can regarding the topic, lah. Right? So first of all, congrats to you guys for being here on a Sunday morning. It must be difficult. Saturday morning. It must be difficult for you as well. So whatever I expect today is for beneficial for all of you, lah. Right? So when it comes to dengue approach, since you guys are doing this for all the years, I'm not so sure how many of you are in fifth year or so on. I will just let you guys know that when it comes to dengue, it is a very common case in the wards, and at the same time, you will see all these patients, if they are coming at once, it will be like if there's one patient in the ward, there will be multiple other cases of dengue as well. So it has its own time, it has its own kind of outbreak, in which at a certain point there will be multiple patients, dengue patients, in the hospital. So if your exams are during that time, then good luck, guys. Then you can you can get dengue case as your modified long case for P and also for IM. Other than that, mostly will ask you men OSCE, PEDS can also, and family medicine can also ask you to do consultation. I had this case in my year 3 block 1, in which we were supposed to consult the mother on the child who was having dengue. So what they did was they gave us these lab reports, and then they asked us to interpret and also tell the mother on the importance of inpatient treatment. Right. So at the same time, so you guys really have to know what is the things that you guys have to focus when you guys want to consult the patient, right? In unmanned OSCE, it can be internal medicine, PEDS, family medicine, community medicine can also be, because of the outbreak, the vector, and all the trait, the environment factor, and then the laws that are connected to dengue. And in emergency as well, because dengue can come in dengue shock, they can come in shock as well. It's called dengue shock syndrome. So it is a broad topic. Even in ONG, you can get dengue, because there will be another management for the pregnant lady. So it can be anywhere, but in professional exam, usually in MLC, there will be no dengue. They can give you a picture of, let's say, okay, I'll show you guys after this. So this is something that you guys should always keep in your mind. All right. I hope I'm clear till now. Okay. Hopefully in professional, you will not get it, but who knows? Suddenly they'll just bring a dengue case. So for introduction, it is the most important arthropod-borne viral diagnosis. So my approach today will be, I'm just going to let you guys know the gist of dengue, And most of the information that I'm going to share is from the CPG itself. All right. So there's Aedes aegypti, Aedes albopictus. If you guys, I think you guys have never been with Prof. Pake, but Dr. Suraya parasitology, this is more to year 1 and year 2. Serotype dengue is 1, 2, 3, 4. Doesn't really matter in Malaysia. You can find all of them. Incubation period is from 4 to 7 days. And the most important thing is the secondary infection, because this is what will lead to the shock, the dengue severe shock and the shock syndrome. So it is due to, the thing about dengue is, if you guys know, like just an interesting fact, that in Philippines, before this, there was something called dengue vaccine. I'm not so sure whether you guys have heard of it. So what happened in this dengue vaccine was, Malaysia was reluctant on it, but Philippines was quite supportive. But what happened was, because of that vaccine, about 1,400 school children died. And this is one of the main points that the anti-vaccine people will use. So why is that? Because in dengue, the secondary infection is worse than the first infection. And in secondary infection is the one who will lead towards severe dengue and so on. And it's because of the antibody dependent enhancement. So after this, I'll explain more like how, which one is better. Is it like the combo test is better, or is it the ELISA test? What is the use of ELISA test? Why IgG, why IgM? All right. So when it comes to dengue, this is the slide that I think everyone should memorize, because number one, this can come out in OST, but at the same time, if you understand this slide, the rest of the things will be very easy already. So most of the patients will come to you with high grade fever. What you guys, whenever you guys find dengue, um, it is never enough to just say the diagnosis as dengue fever. First of all, you guys will have to tell which day of fever. Is it day 1, day 2, day 5? Because all of these days will give us different management and different signs and symptoms from the patient. So first of all, is it, what day is the fever of? Next, you guys will have to know whether is there any warning signs or not. So it will be, for example, day 3, dengue fever with warning signs. And what are the warning signs? So we'll go through the warning signs after this. And the next one will be if there is any complications or if it is severe dengue. So that will give you the full marks of diagnosis, especially when it comes to EMQ. So if you put dengue fever in EMQ, you are not going to get full marks out of it. These are the things that you will have to emphasize on in the diagnosis. All right. So if a patient comes to you febrile, the first 3 days to 4 days actually, there will be high grade fever, and there will be um, there will be this other symptoms as well, because when it comes to dengue, it is kind of like a systemic infection, so you will find many other symptoms as well. To to come to the diagnosis of dengue, you have to have a very high suspicion on dengue. So there will be facial flushing, there will be generalized body ache, vomiting, headache, sore throat, injected uh, pharynx, and then injection. So all of this will like kind of bring you, or is it actually upper respiratory tract infection, or is it GIT infection? So these are also in the differential diagnosis of dengue. All right. So the patient can also come with mild hemorrhagic manifestation. So there will be petechiae. So after this, we will go a little bit further into this petechiae and Hess test or tourniquet test and how to do it. All right. And then if you look at the clinical issue, it will be dehydration. Okay. So the patient will be dehydrated at that time. When it comes to hematocrit, you won't see so many changes, but it will be, you will, if a patient comes and you are suspecting dengue, you should always take baseline platelet and also baseline hematocrit. So you will know what is the trend and whether the patient is becoming better or worse. So these two investigations are, I mean, it's one investigation, FBC, which is very, very important in the overall monitoring and management of dengue. Other investigations are important as well, but they are more towards complications. When it comes to dengue, the two things that you guys always have to look for is the platelet level and the hematocrit. Serology and virology, this is where I think we'll go further in the investigation. But during this first few days, it will be the antigen that will be on the high part. For the IgM and IgG, it takes some time. It's after the fifth day that it will become positive. So that's why we will need the NS1 antigen kit, right? So if let's say the antigen is positive, so you can say that the patient is below the day 5 of the fever or of the infection, because after day 5 it will usually be very low. All right. So I hope you guys understand about the febrile part. The next one will be the critical part. So what happens in the critical part is the temperature will drop. So for patient, they will be happy that their temperature is, decreasing. They think that they are getting better. But generally, if it is going towards severe dengue, this is a very critical area, because even though their temperature is decreasing, but generally they will be losing their what is it, intravascular fluids to third space loss. So in severe dengue, this is what will happen. So there are patients who will become better, but you should always look at their general, general wellness. Are they actually becoming better, or is it just the fever is the only one which is dropping? So when there is this third space loss, because there is increased permeability, so the patient can go into shock, the patient will be bleeding, and this is also where organ impairments can happen. So, uh, and at here is where there will be this compensated or decompensated shock. We will go further into it as well a bit. All right. And at here, if you will look at the hematocrit level, it will increase. Why does hematocrit increase? Because of the third space loss. So uh, there will be hemo concentration, which will cause the hematocrit to increase, and the platelet will drop. So this platelet drop will also cause hemorrhage. So that's why dengue patient can have the hemorrhagic shock as well. All right. And in this critical area is where the IgM and IgG will start to increase. We will go further into it also. Now, when they are in the critical phase, the mainstay of, let's say they are going towards shock, the mainstay of treatment is IV fluids. Okay, we give them crystalloid, right? But the problem after that comes is that in the recovery phase, there will be reabsorption. So if there is reabsorption and we actually have transfused a little bit too much of normal saline, then there will be fluid overload. The patient can have pulmonary edema and other complications as well. So in this uh, in this dengue, some of the most important things that you guys can imagine is that you guys will always have to know what is the urine output or what is the fluid intake of the patient, because that is also going to help you in managing the patient. Okay, so it's quite a complex thing only if the patient goes to severe dengue. All right, but if you guys understand how this flow of intravascular fluid is and so on and so forth, then it will be easier for you to understand on what to focus on and how to manage the patient. Are you guys clear so far? Do you guys have any question? Because this is generally everything about dengue already. After this, I'm just going to talk about a little bit more about what I was saying just now. So I really hope you guys really memorize this and really actually understand this graph. It helps a lot in exams, number one, and number two, also in your management of the patient, right? I think there are no questions right now, right? I will take that as a no. So let's go to the next slide. So, okay, this slide is a bit tricky, but this is just what are the symptoms that the patient can have in febrile phase, in the critical phase, and also in the recovery phase, right? So these are some of the issues in the specific phases. So in febrile, it could be the issue that the doctor can have is to differentiate dengue illness from other febrile illnesses. In critical, as I told before, there is plasma leakage. So there will be clinical deterioration. The patient can go into hypovolemic shock. So when we are talking about shock, you guys also will have to focus on the ABGs. The patient can have metabolic acidosis as well. And some electrolyte imbalances, the patient can have hyponatremia, the patient can have hyperkalemia. So all of these things are really important to look for. So if you guys go to ward and then you guys look through the file of a dengue patient, you guys will see watch out for was it dengue shock or severe dengue and so on and so forth. Because generally the management of dengue is supportive. So we will look at the patient and what is needed, and we will just go according to it. We can't really kill the virus, or we don't have anything for that. Okay. So when in reabsorption, there will be cessation of plasma leakage, there will be reabsorption of fluid, there will be hemodilution to a level that the hematocrit will start to decrease, and then there can be fluid overload and pulmonary edema if we didn't calculate the intravenous fluid therapy correctly. So when it comes to the classifications of dengue, so there can be dengue with or without the warning signs, and there can be severe dengue. So this is something that you guys should memorize as well, because this one card is what you can use for the consultation. If it is about the, you know, if the question is about uh, educating the mother about the disease, okay. So for maybe she will ask, why do you have to, like, what is happening, why is it like this, why do you have to put it in why do you have to give inpatient treatment, why can't I just bring him home, and so on and so forth. So that is where you guys will have to tell about the warning signs. Always look out for the warning signs. So these warning signs are what doctors will want you to put in the positives or the negatives in your history of presenting illness. Okay, so how to memorize these warning signs? There's a mnemonics by KKM itself. So it's all loves. You guys can follow that. Or I used to use Trample, but I forgot what Trample stands for. So you guys can just choose whatever you guys want to choose lah. All right. Okay, so even in this, you guys will kind of get an idea what investigation you guys should what history you should take, what physical examination you should do, and at the same time, what investigations to send for dengue. All right. Like for example, if it's severe organ involvement, then of course you'll have to send for AST or ALT or CNS, and then for heart also, maybe you will have to do ECG and echo. Right. So this is the overall assessment. So you guys can go through it after this lab. I think you guys already get the idea. So these are some of the things that we actually ask each and every patient, because that is how the template is. So if you look at, in our social history, we ask everyone if there's history of dengue, if they went for jungle trekking or swimming, if year three memang setiap, like every social history, they will put this. I know that, I used to do that as well. So if there's any history of traveling, so I hope you guys understand. You guys were actually trying to rule out dengue as one of the differential diagnosis, other than others as well, like malaria and all. So that's why it's important because, as I said just now, the patient can have fever. Usually they come with fever, but there can be vomiting, there can be, acute abdominal pain, there can be diarrhea. So it's quite general. You guys really will have to like go through the history. So that's why any other diagnosis also mimics dengue, and this is one of the biggest problem with dengue. Like, if let's say if it is the first case in an outbreak, so there's no history of dengue in the neighborhood or in the family. Are we just going to let dengue go out of the differential diagnosis? So this is something else that we will have to, consider. So, oh, I wanted to go back. Uh, okay. Oh, sure. All right. So, I hope you guys know about tourniquet test. So tourniquet test is one of the tests that you do in a patient that you can't see the petechial rash. So you can inflate the blood pressure curve to a midpoint of systolic and diastolic for 5 minutes. And if it is positive, then there will be 20 or more petechiae in 1 inch square. All right. And never forget that it's the IL of white in the sea of red and not the other way around. I think many people get confused with it as well. And you will only see this in the recovery phase. So when it is too late already. Lah. So don't really just go around looking for the Isle of White in the Sea of Red. It's just that if you see it, you know that the patient is already in recovery phase, right? So that can be the problem with the reabsorption. Okay. So for investigations, as I said, the full blood count. So you will have to take the baseline total whites and also the hematocrit, and you have to take the hematocrit before IV infusion. So this is where it's either it will be done in the primary care, or if they don't have the facility, then it will be done in the emergency department, right? So full blood count is also used for monitoring. We'll go into monitoring further, and then you will have to take your LFT, your RP, coagulation profile, lactate, blood gases accordingly, lah. Right. When it comes to diagnostic, there are a few in the CPG. So which one to use? When the patient comes first at you, of course you will do rapid combo test. So rapid combo test, you will have the NS1 antigen, IgM and IgG all combined. So you will see which one is positive, which one is negative. Let's say NS1 is positive. That means it is around before day 4 to day 5, because day 4 to day 5 it will start to drop. Okay, when is IgM or IgG, then you can know, okay, this is more than day 5 already. The patient could most probably be in critical phase now. Okay, so but then if let's say the rapid combo test, you can't decide whether which phase it is, or if there is, false negative or something as such, then you guys can go for dengue antigen and serology test by ELISA. So but this is more useful for secondary infection actually, because what happens is the NS1 antigen will usually drop on day 4 to day 5, but let's say if it does not drop, then it may indicate that the patient is having severe dengue. When it comes to IgM, it is positive after day 5 in primary, but when it comes to the secondary infection, sometimes it's very low, you know, because the patient had already had the infection before, so there will not be any surge in IgM, but instead it will be for IgG. So that's why to get the IgM and IgG results separately helps you with the management if it is the secondary infection. And sometimes what happens is, even when IgM is negative up to day 7, then you guys will have to repeat the IgG. Okay. Dengue RT-PCR is usually not done because there are very little facilities that have this service, and at the same time, it's very expensive. So it's not that useful. So yeah, so a dengue IgM is usually positive after day 5 to 7. A negative IgM before day 5 to 7 does not exclude dengue. And then dengue rapid combo test or NS1 antigen taken as soon as dengue infection is suspected. Dengue IgM is negative before day 7. A repeat sample must be taken in recovery phase. If dengue IgM is still negative after day 7, dengue IgG should be done for diagnostic confirmation. Right? So this was one of the pro exam questions. This was, I think this was unmanned OSCE. This is under family medicine. So this is what they give. So what is the apparatus? So this is the, I hope you guys know what this is like. If you guys don't know, then you guys can go to the previous slide, okay? What is the indication? And then list the management if it is positive, all right? So I hope you guys can revise on this, on how to read the results and so on and so forth, because they can give you the result for consultation. They can also give you the results like this, all right? I think even in year 2, one of our exams, they gave us dengue results, and that was for our PMP. So yeah, I know, yeah, it was something. So when it comes to management, it is supportive treatment, as I said before. So first of all, you have to know, if let's say the patient comes to you in primary care or in emergency department, so what are the criteria that can allow you to send the patient back? So usually the patient can have good urine output, tolerate already well, no history of bleeding, absence of warning sign, hemorrhage. Like that guy is just okay. It's just that he's having fever. Okay. And then you have to do serial HCT, look for whether it's stable or not. So what usually KKs will do is they are allowed to go back home, but they will have to come to KK every morning to get their blood done, right? So referral depends on the symptoms, how bad the symptoms are, depends on the signs. If the patient is going towards, shock, and in special treatment, special situations, if they are old, if they have any comorbids, if they are pregnant, if they are on aspirin or any antiplatelet or anticoagulants, it will make the hemorrhage worse. And then you will also have to look for the laboratory criteria. All right. So, but if let's say you find a patient in ward, then most probably, if doctor asks you, doctor will actually ask you, how are you going to manage this patient in ED setting? So if they say ED setting, always go airway, breathing, circulation, take the vital signs, take the blood, investigations, which will be the full blood count, renal profile, LFT, coagulation profile, ABG, right? And then start establish two large granules if in case the patient is going towards if dehydrated or going towards shock, if the vital signs are not stable, okay, and then how much to infuse, okay. Then you can tell about doing a rapid combo test, rapid dengue combo test, and so on and so forth. So that is what I think the doctor will usually ask when it comes to the first question, like how are you going to manage in ED. So, and then how about the monitoring? So this is something that I think if there are any events here, they will appreciate it as a houseman later. So this is actually the summary of what are we looking for and how often should we do it. I'm not going to go too deep into it, but this is just for your reference. So if you look at the parameters for monitoring when it comes to investigation, laboratory parameters and so on. So there's FBC, BUS, LFT, ST, ABG, lactate, troponin, CKMB, all of this, it depends on what the patient is having. We don't do it on everyone, okay? So that's why it's written like as clinically indicated, right? Next will be about dengue shock syndrome. So this is the patient who will come in emergency, and mostly they will be treated in, not mostly, like depends on them, on the situation as well, but they will treat them in the medical emergency, so it will be in the ICU, okay, or at the red zone. So these are the patients who are already hypotensive, which means the pulse pressure is less than 20 millimeter mercury, or the blood pressure (SBP) is less than 90 millimeter mercury. The mainstay of treatment is still IV fluid therapy, but which one to give? Are we going to give colloid or crystalloid? For dengue, whichever dengue it is, they will still prefer crystalloid, because from what I understand, if we give colloid, then there will be an issue when the patient is going towards the recovery phase. So when the patient is going towards recovery phase, colloid will still be there, and when there is reabsorption, it will cause the pulmonary edema and so on. Right. So this is so when it comes to shock, there's compensated and decompensated. So compensated shock is the patient is ill, but the blood pressure is still okay. But decompensated, is when the blood pressure is already hypotensive, right? So that is some way that to simplify the whole table for you guys. Okay, again, this is for anyone who is going through HO. So these are the things that needs to be done. It's always good to memorize it, but yeah, it depends on you. You guys have to study a lot more stuff as well. Just know that what you are looking for. So when we are looking for, in this, for example, we are looking for improvement. If there's no improvement, then we will have to check for the hematocrit. Remember another thing, that in PEEP's protocol, it is already stated that hematocrit is not the mainstay for dehydration in the patient. It is a physical appearance, is the what you get from the physical examination, which is way more important, the clinical examination way more important than hematocrit itself. All right. So let's say in this patient there is no improvement, so you check the HCT. HCT is going high, then you can give colloid. But if let's say it's going low, and then that means that there is significant ocular overbleed. So this is the only place that where you will use colloid. All right. I think you guys can read this by yourself, and then there's like decompensated shock, and how is it? How is that different? Because after that, big, yeah. So another thing that doctors may ask you is how to calculate the maintenance of intravenous fluid. So just now there was like, all these values, right? 3 to 7 and so on and so forth. So how much do we have to give to a patient, and how can we calculate it? So non-obese patient will be it will be easy. But let's say if the BMI is more than 27.5 kilogram per meter square, then we will have to have the adjusted body weight. Okay, so how to calculate adjusted body weight? It will be ideal body weight plus 0.4 multiplied by the actual weight minus the ideal body weight. But how to get the ideal body weight? So this is the examples based on the formula. All right. So this is something that doctors again can ask you in OSCE. They can also ask you in your MLC. All right. And this is actually not only for dengue. Yeah, this can be for anything which requires normal saline. Just remember, not all patients need normal saline or intravenous fluid therapy, generally, okay? So you really have to have good reasoning on why you are transfusing. And secondly, you have to have good knowledge on how much you want to transfuse, okay? So these are two things that you guys should focus on, okay? Okay, so, yep. Let's say that the hematocrit remain unchanged after first fluid resuscitation, then you guys have to consider other causes of shock, which can be septic shock, cardiac dysfunction, cytokine storm, so on and so forth. All right. So this is all from me. I'm sorry to bore you guys. I hope it was not that heavy. Just that this is very concentrated to dengue, okay? Because if you guys read the CPGs, most of the things that I've put in this is from the CPG. you will have complications of dengue. So how are you going to manage the complications of dengue? And then there are dengue in comorbids. Let's say if the patient is having liver failure, so how are you going to manage that patient? If the patient is a CKD patient, how are you going to do it? If pregnant lady, how are you going to manage? So there is a lot more management, but I hope this will be good enough, first of all, for you to understand the topic, and second, to get the general idea of the management. All right. So, no questions, right? I I am assuming there are no questions. Is anyone still alive?
I think no question from the chat also. I think
Yep, we're here.
everything is clear, Doctor.
All right. Okay. So, if you guys have any questions about professional exam, any other topic, or about houseman ke apa, I'm going to start my housemanship. Next week is my PTM. Most of the events are going next week lah. So next week is going to be our program Transformasi Minda, which is brainwashing by the government. Right? So, uh, and then the next week, Monday, I'm going to start in Hoshas already. So there are many events who are in Hoshas. If you guys get to meet us, kalau nak job tu minta je lah, I think. And then if you guys want, I also know lah, kalau nampak kita orang barai ke apa, bagi ya tiket ke apa-apa, okay? Because tak tahu macam mana itu. So yeah, all the best to you guys, especially year 5, Mishkat, for your professional. I think it's coming very soon, right? Yeah, so anything else? You can see me or you guys cannot see me?
Hasnain, you're doing your HO in HTA?
No, in Hoshas.
Oh,
Temerloh.
Hoshas. Oh, okay.